What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we will cover why I went into X-ray school versus nursing school. To give you context, I am an X-ray tech, been pushing the button, certified for 2 years, work graveyard shift at a trauma 3. My lady, she's a nurse. We both went to the same college, except she graduated from the college, I think like a year and a half before I did. So I met her towards the end of nursing school. And if you are trying to get a nurse, it's probably when you're gonna get them, at the very end or at the actual job. Because during nursing school, you can forget it, there ain't enough time. Unless you scooped her up before nursing school. Just putting that out there. Anyways. So I know you're like, Miguel, but you don't know what it's like going to nursing school. No, I don't, but you know who does? The wifey. And one time we sat down and we talked about all the stuff that happens in our respective programs. And I can tell you that X-ray school versus nursing school, they're both challenging in their own regards. But as far as physical demanding, nursing school is up there a little bit more. It would be like there's more information that's being put down your throat in nursing school versus X-ray school. Yet in my school, the X-ray program is a little bit more longer, and we do go to clinicals for more than the nursing does. But there's for instance, my lady told me that she was a student. She had to go a day before to her clinical site and see wherever she was going to be, get a card, put everyone's information in it of who she was going to, who her patients were going to be, and then memorize them all and learn their drugs and learn all this other stuff. Just so the next day she can check off on medicine or whatever, pharmacology, I forgot what it was, just for her to check off on that. Every single time. And I'm like, that's wild, because I only go to clinicals when I have to just show up to do my basic 8 hours of clinicals. I don't have to worry about none of that. So that right there alone is wild. And then as far as they will sit there and do overnight clinicals and then show up to school the next day. Our night shift thing is from 2 to 11. And then, you still have school the next day, but it's not overnight stuff. So that right there is something that's more challenging for them. And then I've noticed the nursing program was always bigger than the X-ray tech program. Ours is technically, you could say, from the amount of seats that are available to apply, ours is 25, 24 per year thing. Theirs is 50, so double. So you could say technically that it's harder or more competitive to get into my program versus nursing program. I know some will say that it's more harder for nursing because of the whole other classes that you have to take. But yet again, there is so many nursing schools you could apply to versus the X-ray part. There is maybe within my state, county. We have one where I live, and then the next one's an hour away, and then the next one's 2 hours away. There's maybe within my local area, but I mean 2, 3, 4 hours around, the radius, maybe 3 we have, versus in the same radius you could probably have 15 for the nursing. So you know what I mean? So there's that. And then as far as the whole prereq classes you have to take, there's 2 of them that we don't have to take. I think it's microbiology we don't have to take, and nutrition we don't have to take. But then again, they don't have to take physics and other stuff that comes with ours. So up or down, but I've been told that microbiology is more harder. And so is pharmacology. I've heard. Our pharmacology / tiny section in our program it's just nothing. It's nothing compared to theirs. Theirs is wild. So you see them nursing students out there stressed. Yeah, it's hard now. And even clinicals, they have their actual instructor up there every single day be like, all right, line up, and check out the fit. Oh, you don't have the right socks, go home. Oh, your thing, go home. Like, it's very strict, my lady told me. Versus ours, oh, we might be there, we might not. Yeah, we'll show up once a semester in your rotation. If we remember, just make sure you're there. You're not doing bad. Like, it's literally so chill. Like, as long as you're there and you have like the 3 things you need: clothes, open shoes, your little markers with your badge, and your docent, like, you'll be good. Like it's simple. Like, ours is not as strict as theirs is. And then as far as cost, I think that it costs more to go to nursing school versus our school. But that's mainly because of all the extra labs and stuff they have to do, which adds more cost. So you have that part. And then I've been told that their actual nursing board is a little bit more complicated than ours is. Ours is like straight up, you just need a 75, regardless of how you get it on the board. And theirs is, okay. And then there's like a structure of like 200 questions, and then that 20 don't count, whatever. There's this like, okay, you sit there, keep on, you just do it, and do it, and do it, and then it'll turn off. And then it's like, did you make it? And it's like, if you get harder and harder questions, that means you're doing good. But then if you get an easy question, and then if it's super long, it's so complicated there. And then my lady, hers was like, she barely did any questions, but they were all like super hard. That's what she said. And then it turned off. I don't know. That's wild what they're thinking. So theirs is even more complicated. So my respects to them. But nursing school is not for everyone. It's very hard. I mean, so is ours. But ours is a different kind of, That's a kind of a general gist of what awaits for you if you are pursuing a degree, or if you're borderline trying to go that. I ain't saying one is better than the other one. I'm just saying, if you want a more chill, not as stressful life, and even job-wise more chill, you can come join us, push the button. But if you're one, I want to change people live, I want to be working, like be there making change, and like be there with the patient care type, and be stressed all the time. You can go be a nurse. You can go ahead, be a nurse, go do that. Because I can tell you, even where I work at overnight, the charge nurse and like 4 other nurses that are there, they literally look at me. I wish I would have done Xray. Even if it would have meant I would have made maybe $1 or $2 less. I wish I would have done Xray. You know how less stuff you have to do as an Xray tech? I'm like, yep. And some of them, like, I'm so deep in debt in school, or it costs me so much to be a nurse. It's too late now. Like, some will spend, like, they'll get their BSRN or whatever, and they'll spend like $100,000. And I'm like, what? Like, ours was like way less than that. But as far as like, if you would match it the same degree versus like RN versus RT, those same would hold. I guess like you would put an BSRN with like someone who would do what, maybe I guess like a nuclear med, or like someone in a nuke med or MRI. I guess because you have to go do more schooling to be there at that level of degree. I guess that would be a reasonable comparison, because they do get paid more, and so does CT and the other stuff. So I guess you would have to hold the other degrees versus a BSRN type stuff. But even then, the closest I would say that you would feel like if you're in the X-ray field, the closest you'll feel about being a nurse, go work CAT scan, daytime, at a trauma like a ER, and you will get worked like a nurse. I mean, you get paid more, but you'll get worked like a nurse. That is a very physical, demanding job, and you're responsible for a lot of stuff. So like they say, more money, more problems. So you can choose where you're at that. But I will say me being X-ray tech is a very relaxed job. Very chill. Very nice. So up to y'all what y'all want to do at the end of the day. I'm just here giving you the knowledge and the information. Because once again, when I was a student, there was never no niche videos in this kind of topic. And yeah, I'll continue making these. I have like 52 videos I'm making. Video a week, so video a year. Like one video every week. So yeah, it's been your boy Miguel. See ya on the next one.